Excellent. Okay, well, I'm going to go ahead and get started. But if you are just joining us, go ahead and throw your country and organization into the chat. And we'd love to see where you're tuning in from. So my name is Susan Melnick, and I'm the Strategic Communication Manager here at ASAP2, which is a USAID project. And ASAP stands for Accelerating Support to Advance Local Partners. This is the second part of a two-part project, and we're really excited to continue the webinar series. This one is an update of one we did last year. There's new information included, and we have a great team here who's going to present it from USAID. So today's webinar series is focused on local partner training on the PEPFAR Human Resources for Health reporting requirement. And there's a lot of information today. So let's go through a few little things. So again, thank you and welcome to the webinar today. Thanks for joining us. We are very thankful to USAID and PEPFAR for supporting these webinars, allowing us to put these on. They're incredibly important, and the USAID team is here today to present. As a reminder, with the ASAP webinars, we like to use the Q&A box. So you can certainly use the chat to communicate and talk to one another or to the panelists today. But for your questions, please try and use the box at the bottom of your screen. We do get quite a number of questions for these webinars, and we like to really keep an eye on them and be able to answer them. So at the very bottom of your screen, separate from the chat box, is a Q&A box, and that's where you'll be able to ask questions throughout the webinar. There's a few different breaks for Q&A today, so we'll be taking those throughout the webinar. And if we don't get to any of your questions, so if today is just a ton of questions and we can't quite answer them all, the USAID team is going to answer them through a document that we will then provide on the ASAP website. So rest assured, we'll get to all of your questions. We do have one quick poll at the end of today's webinar. It's going to pop up on your screen towards the end of the day. And just feel free to go ahead and answer it. And when you're finished, it'll close off of your screen automatically. The presentation for today's webinar is saved on the ASAP website. I'll go ahead and include that link in the chat once I've finished this little introduction, and then also towards the end of the webinar so that you have those resources. And a couple of quick things. So again, we have done a number of these webinars. Today is our 78th. We did many of them under the ASAP1 project, and we'll be continuing throughout ASAP2. I'll provide this link as well, as I mentioned. And we do hold many of the webinars in 3 languages. So today's webinar is fully in English, and then we will hold a separate webinar for French and Portuguese. For past webinars, you can use the filter option on the website to find those specific languages. And I'll include links to the upcoming webinars in the chat as well, in case you would also prefer to hear it in an additional language or would like to share with coworkers. And on the website, we always include the slides. So the slides for this presentation and the recording will be available tomorrow morning. And we'll also send out an email in the coming days that will bring you back to that webpage. And as mentioned, we are going to hold this webinar in French and Portuguese later this month. So French will be on September 20th and Portuguese on September 22nd. And I will include those links in the chat. So now it's my great honor to introduce the team that will be presenting today. Jason Rothenbender is a social scientist with the Health Workforce Branch for the USAID Office of HIV/AIDS. And I'm going to stop sharing and turn over the screen. And Kyle, if you'd like to take over the screen there. Perfect. Over to you, Jason.
Sure. Thanks very much, Susan. Good morning, good afternoon, good evening, everyone. As Susan mentioned, this is the FY22 HRH Inventory training webinar for USAID local partners. My name is Jason Rothenbender, and as Susan said, I'm a social scientist in the Health Workforce Branch at USAID headquarters in Washington, D.C. You'll also hear from 3 colleagues in our branch throughout the presentation: Kyle Borsis, Caroline Kasman, and Geraldine Hoover. Next slide, please, Kyle. A quick overview of our agenda for today is we will provide a high-level overview of the HRH inventory data reporting process this year, including overall PEPFAR reporting timeline, and key changes from last year. Before we go into more detail on each of the specific data elements within the tool and specific examples using the tool itself, we'll also do an overview of everything needed to ensure a successful submission of HRH inventories this year and all the resources that will be available to support the data submission process. Next slide. For most participants on the call, this will be largely a refresher from the FY21 HRH inventory that was completed and submitted last year. The overall submission process is the same as last year. Most of the data elements collected are the same as last year. There are some additional data elements collected, and there are some changes to what's being collected from last year. This training will cover everything related to HRH inventory reporting that anyone new to the HRH reporting process needs to know, but we're also going to be particularly highlighting changes from last year to this year. Next slide. In some broader context of why this is so critical, this activity is so important to the work that we do, is last year, USAID partners reported over 210,000 staff, reported supporting over 210,000 staff and investing over $600 million in that staffing support. On average, 40% of PEPFAR USAID expenditures in any country are supporting partner staff. Next slide. As PEPFAR looks forward to the next 5 years, understanding and optimizing HRH is critical to reaching and sustaining epidemic control. More robust staffing data enables further optimization and increases accountability of our HRH investments by providing insight into staffing function, location, and compensation. Also, critically, HRH inventory data informs our sustainability planning. Next slide. The data collected through HRH inventory is not analyzed in isolation. The data collected aligns with expenditure reporting in a number of ways, particularly through the ER cost categories, program areas, mode of hiring, and staffing expenditures. This allows us to better understand HRH and staffing data in the context of total PEPFAR expenditures. Next slide. As I mentioned earlier, the overall reporting process for the FY22 HRH inventory is the same as the reporting process last year, FY21. Specifically, each partner within an OU will download and complete a single Excel template, which will then be uploaded and submitted into Datum. The Excel template will be available for download on Datum by October 3rd. Within each template, each row is for an individual staff member. The Excel templates cannot be modified. By that, we mean adding or deleting columns or making other formatting changes. If those modifications are made, it won't be able to be successfully uploaded and submitted into Datum. Anyone uploading and submitting the template into Datum will need to have a Datum account. And all of this will be discussed in the presentation with step-by-step information, including how to download, where to download the template, how to download the template, how to upload the template, and how to submit the template, as well as how to create a Datum account. Next slide. And who needs to submit the HRH inventory? All mechanisms that report to expenditure reporting should report to the HRH inventory. Each prime partner submits one Excel template into Datum. If you have sub-implementing partners, then that sub-recipient staffing must be included and consolidated into the single Excel template that's submitted by the prime partner. Again, there's one template per IM. Next slide. And what staff need to be reported or included in the HRH inventory template? Every individual that receives any form of compensation from PEPFAR over the past fiscal year. That includes health workers, program management, technical assistants, HQ headquarters-based staff that are charged directly to the IM, staff receiving a salary, a stipend, a contract, including non-monetary support, prime recipients, sub-recipients. The only staff needs to be excluded are if they're charged to NCRA only or if they're USG staff. So if we look at this flow chart on the left part of the slide, it's quite clear. If the individual receives any form of compensation from PEPFAR in the past year, if the answer to that is yes, and they are salary, contract, stipend, or non-monetary compensation, then yes, they must be included. If they are a US government employee or an employee that's only charged to NCRA, then no. And if they don't receive any form of compensation from PEPFAR, they do not need to be included. Next slide. Now, we're going to talk about this a little bit later in the presentation about how specifically to fill out non-monetary compensation. But non-monetary compensation includes anything that's purchased for the purpose of incentivizing the work. It doesn't include support in order to perform one's duties, one's job duties. So non-monetary compensation would include purchases of household goods or clothing or travel for personal use, a phone received for personal use. It would not include the purchase of airtime that's needed to perform one's job duties or just to pay for travel in support of one's job duties. And we will talk about this again later in the presentation when we talk about how to complete this section, but wanted to flag early that non-monetary compensation, staff receiving non-monetary compensation should be included in the HRH inventories. Next slide. Next slide. So HRH inventory reporting is consistent with the PEPFAR data calendar for Q4 reporting. We request everyone who's going to be submitting the HRH inventory on behalf of their mechanism or their IM to create a Datum user account prior to October 1st. That can be done now, creating those accounts. And the reason we recommend doing that prior to October 1st is because given HRH inventory aligns with the Q4 reporting timeline, Datum opens for reporting on October 3rd. So we want to create the accounts now. So when the Q4 reporting window is open beginning October 3rd, we can begin, the templates can begin to be submitted. The Q4 reporting time deadline is November 10th. So we have October 3rd to November 10th. Then there is a brief Q4 data cleaning window when IPs can resubmit if needed between December 1st and December 16th. These deadlines, they're not internal agency deadlines. These reflect when Datum is open and closed for Q4 reporting. You'll not be able to upload or submit HRH inventory templates into Datum outside of those windows. Next slide. So what is needed in order to complete the HRH inventory requirement? A copy of the OU-specific FY22 HRH inventory template. A final version of this template will be available for download by October 3rd. The HRH inventory guidance materials. Right now we have the link to where the FY21 materials are posted. We are expecting updated materials to be posted for FY22 by next week using that same link. And we'll go over that in a little bit more detail towards the end of the presentation. Internal records, HR payroll records and program records that capture staff work and location. Those are necessary inputs to successfully complete the HRH inventory template. And lastly, an HRH Datum account. The link is there, register.datum.org to create a new one. But again, the end of this presentation, we will go step by step with how to create an account, how to download the template, and how to submit the template. Next slide, please. We'll do a quick knowledge check, and maybe you can enter your response in the chat. But what mechanisms need to complete and submit the HRH inventory Excel tool? Yep, I'm seeing some of the responses now. Correct. Kyle, can you next slide, please? Right, many of you exactly right. All mechanisms that report in ER and that have expenditures associated with COP approvals. So all mechanisms that are receiving PEPFAR funding, all staff that's reporting PEPFAR funding, and all mechanisms that report in ER and have expenditures with COP approvals. Yep, correct. Next slide. The next question, and I'm seeing this, next question is, what type of staff should be included in your HRH inventories? Prime partners, subrecipients, program management staff, clinical and ancillary staff who deliver services, other staff that provide technical assistance and support non-service delivery activities, or all of the above? Yep, I'm seeing lots of responses with F, all of the above, and that is exactly right. The answer is F. All staff that receive some form of support should be reported. Health workers, program management, TA, HQ-based staff charged directly to the IM. It applies to prime partners and subrecipient staffing. Staff receiving all types of compensation, salary, stipend, contract, non-monetary support, all should be reported. Exactly right. Should staff working for sub-recipient partners also be reported in the HRH inventory? Yep. Okay, we can move on to the response. See lots of yeses, and that's correct. All PEPFAR supported subrecipient staff working for a mechanism should be reported. There should be one template submitted per IM, which should include staffing information for prime partners as well as any subrecipients. Thanks. Next slide. When can partners begin to submit their completed FY22 HRH inventory templates into Datum? Yep. And Kyle, we can move forward to the response. That's right. I'm seeing many of you typing it in. Yep. Datum opens for HRH inventory submissions beginning October 3rd, 2022. So in a few weeks. Next slide. Thanks very much. There's much more to come, but I'm going to turn it over to my colleagues, Kyle Borsis and Caroline Kasman, to lead us through this next section.
Okay. Thank you, Jason, and hi, everyone. As Jason said, I'm Caroline, a member of the Health Workforce Branch alongside Geraldine, Jason, Kyle, and Diana, and I will be walking through some of the changes to the HRH inventory template this year. So in 2022, the inventory template has a few new fields alongside some expanded options for already existing data elements. Later, we will be going through these changes in detail as well as holding space for questions. This slide and the next few slides are just an initial overview. So jumping in, one of the new fields allows you to write the name of the subrecipient implementing partner, or IP, if the staff member is employed through a sub-IP. You can also now specify if the staff member is a national level staff member or if they are based outside of the operating unit or ORU. You can also now designate the primary beneficiary group for each worker, meaning which population the staff member supports. There is also a field to specify if the staff member's primary role is to provide technical assistance. Finally, there is also a new field to designate the total non-monetary compensation for each worker, such as Jason described. Of the fields that have expanded options, the program area field now allows you to fill out more detail about the type of program the staff member supports, specifically for the PREV or prevention, HTS or testing, and CNT or care and treatment program areas. The gender field is also expanded to be more inclusive and now has options if the staff member identifies as non-binary, transgender, or other. And finally, the employment title list has been refined. Next slide, please. Now that we've done our initial review of the changes to the template since last year, we're going to do a quick overview of the structure of the HRH template itself. So there are unique HRH inventory templates for each operating unit, and each mechanism associated with the OU must fill out that OU specific template and submit it to the HRH data map. As a quick note, in addition to this presentation being recorded, as Jason mentioned, all this information is in the PEPFAR HRH inventory template handbook for guidance, which we will also provide. And these next few slides will review a few key elements of the template. Next slide, please. So the HRH inventory template has three main sections or tabs. The first is the cover sheet, which contains questions at the general level about the mechanism's health workforce, including the specific operating unit, funding agency, and mechanism information. The second section or tab is about the staff list, which includes detailed questions about each individual staff member, including their title, mode of hire, FTE per month, and staffing expenditure. And next slide, please. And as a quick note, we will be providing an overview of all of the fields in the staff list tab later in the presentation. The third section or tab is the FTE calculator, which is a user-friendly tool that will calculate the average FTE per month for each staff member, which is what you will use to fill out the FTE per month question in the staff list tab. Next slide, please. I'm now going to go over the first section, the cover sheet tab, a little more in detail. As mentioned before, this tab contains questions about general information on each mechanism. The cover sheet tab has fields that ask for information such as mechanism name, mechanism ID, as well as prime partner organization, and the name of the person USAID can contact for follow-up questions about the submitted data. It also asks for a list of sub-IPs that were contracted by the prime partner organization. Next slide, please. Now looking at the staff list tab, which is the section that asks for detail about individual staff members. You will enter one row of information per staff member and fill out all the fields for each staff member with the possible exception of the Datum hierarchy section, which is what you can see in blue here, the record number and the comment sections. We will discuss these exceptions in further detail in later slides as well. And as a general note, you must choose from the drop-down options and when available for each field. And you also cannot modify this template, as this will cause Datum to not upload the template properly. Next slide, please. And now my team member Kyle will walk through the staff list tab in more detail.
Hi everyone, my name is Kyle, and as Caroline mentioned, I'll be walking through each of the data elements here within the staff list tab. So we'll mainly be focusing on these data elements this year in terms of what is new, and this is sort of highlighted here in blue. And then also here, we'll also go through what are the expanded fields for this year. So this gives you sort of an overview within the data collection tool. A lot of the data elements that will be included in the tool this year, this has remained relatively unchanged from last year, except as you can see in the legend, there are a few things that have sort of been new or have been updated. So here, this gives you the lay of the land in blue here. What are the new fields that we'll be going through, as Caroline already mentioned. And in the subsequent slides, we'll be going through in more detail what those additional fields entails in terms of their definitions and how to fill them out. And we'll also do sort of a live demonstration later on to sort of go through how you would fill out that data collection tool with all of these additional fields and all of these existing fields that has remained unchanged or has been expanded in terms of their additional responses. But overall, the data collection tool has remained mostly remained unchanged from last year, except there's about 6 additional fields that we are collecting this year and that is of interest. And that's something that we'll be focusing on in the next few slides, since that's something that we'll have to pay attention to. And there are a few others that has been expanded or refined, but has, for the most part, remained the same. So now that you have a lay of the land of sort of the main data collection questions that's in the staff list tab, we can just dive right into it in terms of the data elements included in the data collection tool. So here in the first few fields, the first column will be focused on record number, which is an optional alphanumeric field that can be assigned to staff entered in the data collection tool. However, in this record number tab, the column, we recommend to not complete this field, given that sometimes we run into the risk of implementing partners to include personally identifiable information in this column, which is somewhat of a risk. So on our end, we recommend to not complete this column and just leave it blank, just to sort of remove that potential risk of adding personally identifiable unique identification numbers that could have been assigned to staff, since we would not want that. So for this column, we strongly recommend that you just leave this blank. So that's for the first column. And then for the next few columns in the data collection tool here, for the second column, this is the same from last year. We just want you to designate whether that staff has been employed by the prime implementing partner or is a subrecipient implementation partner. So in this case, if it's a prime, just put a prime. If it's a subrecipient for that staff member, then put subrecipient. So that has just remained the same from last year. And then here in the third column, we have a new field, and it's called if sub selects the IP name or the implementation partner's name. So in the prior field, if that staff member worked for a subrecipient, then you will need to enter within a dropdown the name of that IP name or implementation partner that's considered under that subrecipient category. So in the cover tab, since there are three 3 tabs within the data collection tool. In the cover tab, you will, as Caroline mentioned, you will enter sort of general information about your mechanism and implementation name and so forth. But part of that also is that within the cover tab, you will also list down the list of subrecipients that was a part of that implementation mechanism. So based on what you entered in the cover page in terms of the subrecipient names, you can then select from the drop-down menu here for this column on the name of the subrecipient name. And so that's something new this year. We want to focus on and keep track of the subrecipients that was supported by PEPFAR. So we would want you to include that. And then next year we have gender. This has remained mostly the same from last year, but has been more expanded to include additional options as well. So just to sort of note that, and there's also additional fields as well, where we've expanded additional response options. And here we have employment titles. This is also fairly important to get correctly. Principally, this has remained the same as last year in terms of how you populate this variable within the data collection tool, except for this year, we have refined the employment titles list a bit more. And in the next few slides, you will see the complete list of employment titles. But just to let you know that the employment titles list has sort of been expanded to be a bit more comprehensive. But even if the response options have been refined a bit more, the principle of, again, when it comes to employment titles, capturing the role of that individual in terms of the employment title that primarily captures the role of the individual, that's the main principle you should be following by when filling in this particular column. We understand that given the variety of programs in different countries, that job titles may not exactly match the official job title of that individual. So again, within this column, we would just want you to pick the employment title within that drop-down list that best matches the official job title of that individual. But we have expanded it a bit more this year, so hopefully you can find something that makes sense. And again, within this column, you would only include for each staff member representing it only in one row. And in the next few slides here, you'll see that we'll have a more expansive list of the employment titles. And again, for these employment titles, there will be more descriptions and breakdown of them in the HRH handbook. So we'll probably refer you there in terms of getting a better handle of the descriptions of each of these expansive lists of employment titles. But we do have that document for reference. And again, when it comes to employment titles, we just wanted to emphasize that similar to last year, when it comes to employment titles, it should really reflect the work being done by the individual or the roles or jobs and responsibilities of the individual. That should primarily be the criteria for filling out the employment title. And it should not be based on that person's prior training or prior qualifications. So what we mean by that is that, for example, if you have a nurse that's primarily providing facility management or administration support within the health facilities, but is not actually delivering health services as a nurse, then that person within the data collection tool, their employment title should be facility administrator and not as a nurse. Because again, here we are concerned with the primary role and responsibilities of that person, not their prior degree or training. And as I mentioned before, this is the more expansive and refined list of employment titles this year. This has been mapped to the expenditure reporting categories. If they're healthcare workers that are traditionally falls under clinical staff, or if they're healthcare workers that fall under ancillary staff, we sort of bucketed them here accordingly. And if they are non-healthcare workers, they would fall under other staff here. And you can see they're a bit more expansive this year. And again, in terms of the descriptions behind each of these employment titles, this will all be outlined in the HOH handbook, which you can all have for reference. And for example, here for program management, you can see that it has been expanded to include additional granularity this year, and that's the same for the other categories as well. So just a quick knowledge check, just to make sure that we are on the same page. So first off, here in this scenario, you have a medical doctor by training, but is working for your program as a technical advisor for HIV care and treatment. So in this scenario, would you select A for doctor or B for technical advisor for the employment title? What do you think? Put it in the chat, and I cannot see the chat, by the way, since I'm presenting, so let me know. If not, I'm just gonna walk through it. But in this example, where you have this medical doctor by training, but their primary role is being a technical advisor, then the response should be B for a technical advisor, since again, we are concerned with the work being done. In this case, that person was providing advisory support, even though they are a doctor by training. That is not the criteria for which you would be filling out employment titles. So moving on here in terms of the additional fields to be populated within the data collection tool, we have the mode of hiring. So this is, again, the same as last year and has remained unchanged. And within the mode of hire, there are 3 responses that you can choose from. So firstly, we have a salary, which hopefully should be more straightforward. Basically, any sort of PEPFAR funded worker employed by an implementation partner or IP, and they are receiving a salary or a wage, then that amount, then it should be entered as salary here for this mode of hire. And then secondly, if that worker is a contract worker or is under contract to perform a set of services, usually for a set amount of time for a PEPFAR supported program, then they would be put under contract. Any sort of worker that is not directly employed by an IP, but is contracted to perform services, they would fall under this category. And this includes any sort of PEPFAR supported workers that received stipends. They would be under the contract category. And then lastly, we have non-monetary only, and we sort of walked through what we mean by this earlier upfront during the presentation, but this is again remain the same from last year. And by non-monetary, we mean that any sort of PEPFAR funded compensation that is not monetary in nature, and usually comes in the form of work incentives. So any sort of purchase goods to incentivize work, or any sort of airtime or travel reimbursement for exclusively for the personal use of that staff member, then that would be considered as non-monetary compensation. And we just want to emphasize that, in that non-monetary compensation refers to any sort of work incentives that will, instead of monetary compensation, you would be providing work incentives to be able to encourage work for that program instead of providing them a monetary value. So in this case, for non-monetary, we don't mean any sort of supplies or other resources required for fulfilling your job duties. As Jason mentioned prior in the earlier slide, any sort of supplies and equipment that is needed to perform that person's job, you would not include that here because it was needed to perform their job. But any sort of work incentives for personal use to incentivize work, then that would be considered non-monetary compensation. And we'll talk about this a little bit more in later slides, but again, that's sort of a brief overview by what we mean by that. And here, moving on to the next few columns in the data collection tool, these 2 fields have remained unchanged from last year. So here, when we say MOH staff or seconded to MOH, this is the same in that we want to know whether that individual was officially designated as a government MOH supported by PEPFAR, or is a staff member hired by an IP, but then seconded to the Ministry of Health. So that's something that we still want to keep track of this year. And then here within the month of work in the past year, this is the same as last year, where you need to indicate the total number of months that that PEPFAR worker worked within the last fiscal year, which here is defined between October 1st all the way to September 30th of this year. And you can answer that in decimal format within the data collection tool. So Jason, you want to pick this up on FTEs?
Sure, thanks very much, Kyle. The next data element is average FTE per person. And this is a way to understand and measure staffing size when the number of hours worked vary by worker. And this is unchanged from last year. So colleagues that submitted this last year should look very familiar. Specific for responding to this question about the average FTE per month, it's asking to enter a value between 0 and 1. Entering 1 or 1.0 would mean that the staff member is a full-time worker each of the months that they worked over the previous year. Entering a value of 0.5 would mean that the staff worker works half the time of a full-time staff member during the months that they worked over the previous year. We're only asking to enter the FTE supported by PEPFAR here. So if the FTE is separately supported financially by the Ministry of Health or another entity, we do not want that included. We only want to know the FTE per month that's supported by PEPFAR. Next slide, please. So I know this is maybe a little bit clearer when a worker is full-time, it's 1.0, but it can get much more complex with different types of staff that work different numbers of hours during the months that they worked. And we can think of a few different scenarios with varying hours worked. If workers' hours remain constant each week, if they remain constant each month, if they differ in the hours that they work month to month or week to week. Here are some examples outlined in this table, but these were pulled, looking at the FTE, looking at, whether their hours worked were consistent weekly, consistent monthly, varied weekly, varied monthly, and we can see that the average monthly FTE in that right column, what that value is. But how did we get there? And we can go to the next slide. Last year, we had something called an FTE calculator, which was a separate Excel tool that could be used. It was optional, but could be used, downloaded from Zendesk, and could be used to help calculate the average monthly FTE for different types of staff. This year, we've included that FTE calculator as a sheet in the HRH inventory template. So it's not something you need to download separately or find online. It will be included as a sheet available to you to use to calculate FTEs if needed. It's a little tough to see in this particular visual, but the 4 scenarios that were described on the previous slide, those are different options where you can enter in values. If there's a consistent number of hours worked in a week, you can enter that and see what the average monthly FTE would result in. If hours worked vary month to month, you could enter in the hours worked for the different months, and it will calculate an average monthly FTE. There are 4 different scenarios that data can be inputted, and it will generate an average monthly FTE for you. And again, this is something that is unchanged from last year, but now is included in the Excel tool. So we don't need to seek it out separately, and it's not a separate file. Next slide, please. This next data element is new for FY22, and it's asking if the staff member primarily supports work in the community. This refers to staff primarily delivering or supporting the delivery of non-facility-based activities at the community level, like social mobilization, health education, etc. Some examples of community-level staff can include community health workers, peer educators, peer navigators, dreams mentors, community mobilizers and facilitators, prevention of HIV and sexual abuse facilitators, and the options are yes or no to this new column. Next slide, please. This next data element works in or supports multiple facility sites roving staff. This is unchanged from last year. It's asking about whether the PEPFAR supported worker provides services at multiple facilities on a regular basis. If the staff member does work routinely at multiple facility sites, then the answer is yes. If the staff member does not provide work at multiple facility sites, or rarely provides services to more than one facility, then the answer would be no. Roving staff are only associated with facilities and work at the site level. Next slide. This next column is another new data element collected for FY22. It's a new field and the response options are yes or no. It's asking, is this staff member technical assistance staff? Technical assistance staff, or TA, primarily support or improve the delivery of services, but do not directly interact with patients or beneficiaries in response to their healthcare needs. Some examples of TA activities can include conducting training workshops to improve technical capacity of staff, provide expert guidance on specific topics like M&E, supply chain management, health financing. All above site individuals that primarily facilitate or strengthen service delivery providers should select yes in this to this question. Program management staff would not be technical assistance staff though, so it does differ slightly from all non-service delivery. Okay, next slide. This is another new column. It's yes or no responses for is this position based outside of the OU? So it's please indicate whether this position is primarily based in a location outside of the operating unit. So for country programs outside of the country, for regional programs outside of the region. These international workers, so you can think of staff based in the US that spend a portion of their time supporting the implementing partner, should leave all geographic hierarchy columns blank unless supporting an IM in a specific PEPFAR region, in which case they should select the country and SNU1. So that's getting a little bit ahead of ourselves, but is a nice segue into the next section, which is really looking into the Datum geographic hierarchy. So now we're entering the geographic hierarchy section of the template. And last year, we received a lot of great questions and feedback on how to enter this information, and we'll try to present it a number of different ways in this PowerPoint. And also, I want to plug two things. I know they've been mentioned in the chat and throughout this presentation that yes, all of these slides will be available, online. I think Susan said by tomorrow. I also want to plug that the information that we're sharing is all captured in the FY22 HRH Inventory Handbook, which we anticipate should be published by SGAC on the Zendesk website by next week. And just like last year, both SGAC and us, USAID, will be sort of routinely updating a frequently asked questions resource and sharing that with you. So there are a number of different ways that we will provide this information and make it available as soon as possible, and also be updating from now through the end of the Q4 submission process. Okay, back to the geographic hierarchy. The format and the structure of these columns, let's go back one, Kyle, if you don't mind. The format and structure of these columns is the same as last year. There are some slight guidance changes on how to complete these columns for this year, and we'll point those out explicitly. The geographic information is entered, so we have a better understanding of where staff are working, and if they're working in multiple locations, and where the majority of the work we're supporting is being performed. The columns, just generally, from left to right, will be going from a larger geographic area down to a smaller and more localized geographic area. And so through the next few slides, the guiding question I think that would be helpful to keep in our minds is always thinking about how local do I need to enter the geographic information for this staff member? I think that's sort of the guiding principle when trying to fill out these columns for the HRH inventory template. Next slide, please. Let me do one more click. As a reminder, from last year on PEPFAR Datum hierarchy, this is unchanged. It's unchanged in the process and the layout and the overall structure. Those not as familiar with some of the PEPFAR specific language, OU stands for operating unit, which we have 3 regions which are operating units, but then outside of those 3 PEPFAR regions, all operating units are countries. There's SNU, which stands for subnational unit, which is just a smaller geographic unit than the OU, and those are now numbered. So SNU1 would be a smaller geographic unit than the OU, SNU2 would be a smaller geographic unit than SNU1, etc. And we get, you can see on the right side of the slide, we'll go from the operating unit, in this case Malawi, go to SNU1, SNU2, SNU3, and SNU4, and we get down to levels that are community level and facility level. Sorry, there's 3 levels. We want to identify a PSNU, which stands for priority SNU. That was the SNU or the geographic level where PEPFAR program targets are set. And we also have community level and a facility level. The facility level is always the most granular, the most localized geographic unit that we have in PEPFAR. Next slide. So there's 3 templates technically across all of PEPFAR, but we try to break this out in this slide and in subsequent slides so you can focus in on the one template you'll be downloading. The only difference between the templates is the number of geographic columns they have. So you're either going to receive this initial template, which has just has 3 columns. Well, you have different templates based on your country's geographic hierarchy, but you're only going to download and receive one. And the key distinction is really 2 distinctions. One, there's a separate template for regions because their geographic hierarchy includes multiple countries and is a little bit different. But the distinction between the Datum template number 1 and Datum template number 2 is whether or not the PSNU level and the community level is the same with your country. So essentially what that's sort of saying is PEPFAR planning done, is the PSNU level, is that PEPFAR planning done at the community level, or is it done at a higher a larger geographic level, the PSNU level? So what do we really need to know is, based on the country or region you see on the right, that is how many columns, the geographic columns you'll see on the template that you download from Datum. This is unchanged from the number of columns that you saw when you downloaded this template last year for partners that completed the inventory in FY21. Next slide, please. And again, the key question is each entry must complete the Datum hierarchy down to the appropriate level. And the appropriate level is based on the location of the worker, and the location of the worker is defined as where the individual performs their work. Next slide. So really, it's that underlying question I mentioned a few minutes ago of thinking, okay, based on that staff member and what they do in their roles, how localized do I need to report? And we'll go through this same table for each of those 3 templates, but it's the same concept. And again, you'll only need to reference one of these tables, and it'd be useful to keep in handy to know how localized do I need to report this staff member. So for the OUs on the right, Botswana, Cameroon, DRC, Ethiopia, Malawi, Mozambique, Namibia, Ukraine, Zambia, Zimbabwe, those are the OUs where the PEPFAR Datum hierarchy has just 1 column for PSNU and community. It's the same geographic level. So if the staff is based outside of those countries, outside of the OU, they don't work in multiple sites, and you actually don't need to enter any geographic information for those staff members. You've said yes, they work outside the OU, and then the rest can be left blank. If they're national or military staff, they don't work in multiple sites, we do want them reported to the SNU1 category, and then the next 2 columns, the PSNU community column and facility, can be left blank. For above site workers, they don't work in multiple sites, and we ask that we'll go this from the other side, that they're above site, so we wouldn't want anything entered at the facility level, but how low or how localized you go from SNU1 to the PSNU community column, it depends on any of those options would be valid. So we'd recommend going as granular, as local as appropriate, but either one of those selections will be valid in the tool. For community-based staff, they would not work in multiple sites, but we ask this be entered down as local as that PSNU community column. That's a change from last year where much of this was entered at the PSNU level, and now we want to ensure it's down to the community level for FY22 reporting. Roving staff, so that's facility-based staff that work at multiple facility sites. We would say yes, they work in or support multiple sites, the roving staff, and we would want this entered down as local as that PSNU/community column. And of course, for facility-based staff that are working at a specific individual facility, we would want that geographic information entered all the way down to the facility level. And all these columns are pull downs. They're also dynamic. So, the SNU1 you select will then result in a smaller list of potential PSNU community options, and based on which community you select will result in a smaller list of facility pull down options. So working from left to right and going from larger to more localized is the best way to complete this section of the tool. Next slide, please. So this is the same table, but this is just breaking it down for the countries where the PSNU level and the community level are distinct. So in terms of the structure of the Excel tool that you're downloading, that just means there's an extra column for geography. And the countries that'll be downloading, if you're supporting programs in the countries on the right, Angola, Burundi, Cote d'Ivoire, Eswatini, Haiti, Nigeria, Rwanda, South Africa, South Sudan, Tanzania, Kenya, Lesotho, Uganda, Vietnam. This is the amount of columns that you'll see in the geographic hierarchy section of the tool. This is again the same that you saw last year. The same column headings that you saw last year. And I would just follow the same structure that we outlined on the previous slide. For national and military staff, it's entering down to the SNU1 level, but everything more localized than that can be left blank. Above site workers, they're not roving, would not enter facility level, but enter the appropriate geographic area that applies to where that staff is providing services or supporting services. For community level staff, it's entering down to the community level column. For roving staff, it's now entering down to the community level column. So the community level where the different facilities that individual routinely works out of, that's the level we'd want. We want that reported down to the community level. And then, of course, for facility level, facility-based staff at a single facility, the geographic information from left to right, all the way down to that facility column. Next slide. For our colleagues that are calling that support work in a PEPFAR region, so Asia regional, Western Hemisphere region, or West Africa region, it's slightly different. The geographic hierarchy for regions, and this is exactly how it is in Datum, where SNU1 isn't actually a subnational unit, it's the countries within the region. So we have a slightly modified table for our regional local partners. For international staff, it's reporting down to that country level, that SNU1 level. For national military, it's similarly, we've outlined how localized each of those locations of work or staff at those locations of work should be reported, and similarly show the columns that you'll see on your regional template. Next slide, please. Let's do a quick knowledge check, and I just real quickly, we definitely, we receive a lot of feedback and try to improve these tools and make enhancements from year to year. And we certainly had a lot of questions related to geographic hierarchy. We're all hoping that the tables that we've outlined for the different templates is helpful in providing clarity. And again, that's also something that's going to be included in the FY22 handbook that's going to be published next week, as well as other resources that we'll continue to put out and try to clarify anything that needs clarification throughout the submission process. So for this question, I'm already seeing lots of the responses. For community workers not attached to specific facilities, how would you answer the question, does staff work in or support multiple sites? And Kyle, next response. So this would actually be B, that the staff that are working at the community level and are not attached to any facilities should answer no. The question is intended to capture facility-based workers that move across multiple facility sites. So if they work routinely across multiple facility sites, then the answer would be yes for does the staff support multiple sites. Kyle, I think I turn it back to you for this section.
Sure. Thanks, Jason. And hopefully you can hear me. I don't think my video is working anymore. Okay, here we go. All right, I'm back. Great. So moving on to these the last few fields here around primary program area. This is a field that has was available last year, but this year we have further expanded this a bit more, and that we've added a bit more granular detail in terms of additional response options, so we can have a more detailed breakdown of what type of programmatic areas that each staff member is working under. So similar to last year, again, you would want to select the primary program area that that individual staff supports. We understand that sometimes an individual staff member can support multiple program areas, but we ask that you only select one in this data collection template. And by that, what we mean is that you would primarily want to select the program area that that staff member mainly supports or primarily works in or spends their most time in for that program area. So in this case, if an individual supports 2 areas, but they spend the majority of their time, for example, 3/4 of their time or 75% of their time in one area, then you will want to select that primary program area for that individual staff. And in the subsequent slides, you'll see that the expanded list of program areas here. And again, this is a bit more granular from last year. In that last year, we typically can enter site level or above site program areas, and within the site level, you can enter whether they worked in prevention, socioeconomic testing, or care and treatment. But this year, we've been a little bit more detailed and disaggregated, and that we can provide additional breakdowns of the specific activities within that program area that that staff member is primarily engaged in. So again, you want to be able to select the primary program area that that staff member is working on, understanding that sometimes people work in multiple areas, but you only select one, preferably the primary one that they are engaged in. And in here, this just sort of shows you the summary mapping or table, and that based on your work location that Jason already walked through in the previous geographic locations slides, in terms of how that maps to the primary program area that that person should be selected under. So if for example, that person is mainly doing above site activities, then the primary program area for that person should be under the above site categories or under program management. If for that staff member, in terms of their location of work is mainly at the community level, is considered roving staff that works on multiple facilities at once, or is mainly focused on a single facility, then the primary program area for that staff member should be at site level. And there's different sort of options within the site level category in terms of the activities they're specifically engaged in, but you will want to be looking at the site level drop-down options. And you will see a little bit more later on how this plays out when we do a live walkthrough of how you would fill that out in the data collection tool. And here, again, with the primary program area, we just wanted to emphasize again that A, you want to choose the primary program area, but then B, even if you choose a primary program area, you still want to report the full-time FTE that that staff member is doing to support PEPFAR programs, and also the total expenditure for that PEPFAR supported worker. So even if you are selecting one primary program area, even though you're only selecting one program area, you still want to fully report the full FTE that that staff member is doing for PEPFAR and the overall total expenditure that that person is doing for PEPFAR. So in this case, for example, if you have and reporting a full-time nurse who spends 3/4 of her time on general HIV care and treatment services, and only 1/4 of their time on HIV testing, and their total annual expenditure, for example, their salary is $2,500. In this case, within the data collection tool, you would select on their program area, general CNT, which stands for general care and treatment, because that's the primary program area that that nurse spends most of their time in. And under the FTE and expenditure columns within the data collection tool, you would enter 1 for FTE even though 75% of their time is focused on care and treatment, you still want to report that as a full-time equivalent of value of 1 for the data collection template, and you still want to report the total expenditure for that staff as 2,500, since that staff is fully supporting PEPFAR programs, even though you are selecting only one primary program area. So hopefully that makes sense, and we can do a better demonstration of that later on. And here, in terms of additional fields and what is new for this year, we still have this new column called primary beneficiary. So this year we are aiming to track a bit more in terms of the primary beneficiaries that each staff member is primarily supporting if possible. So within this primary beneficiary column, there will also be a drop-down menu, and there are 11 potential responses here in terms of primary beneficiaries that you can choose from. Again, a lot of these definitions will be in the HRH PEPFAR handbook, and I won't be going through the definitions of each of these primary beneficiaries in this presentation. Again, we'll refer you to the HRH PEPFAR handbook, where this is all outlined in terms of the definition behind these primary beneficiaries. But we just wanted to let you know that for this year, we are keeping track of the primary beneficiaries for which the activities for each staff member is mainly contributing towards, since that is something of interest that we want to have a better sense of. And again, a lot of these definitions are outlined in the PEPFAR handbook, and for the sake of time, we will just give you an overview here, and then perhaps look through the demonstration later on for how you would fill this out. And in here, in terms of the last few data elements, we still have the service delivery and non-service delivery column this year. This again is the same from last year, where you can outline whether that staff member is directly engaged in service delivery activities, or whether they are mainly doing non-service delivery activities. And hopefully this should be more straightforward, and that for this column, you will enter direct service delivery if that a staff member is directly interacting with beneficiaries or patients, and providing health services directly to beneficiaries. And for non-service delivery activities, these are mainly above-site activities that are meant to support, facilitate, or strengthen service delivery, but are not actually directly interacting with beneficiaries and providing health services to beneficiaries directly. So that would be considered non-service delivery. And yeah, hopefully that should be more self-explanatory. This has remained the same as last year. And we can see a little bit more later on what we mean by each of these two categories, but service delivery and non-service delivery should hopefully be more straightforward. And in here, in terms of this additional column for COVID-19 support, this has also remained unchanged from last year, and that we are still interested in tracking any staff members that supported the delivery of COVID-19 specific services. And what we mean by that in terms of services is that this could include any sort of service delivery for COVID-19, such as COVID-19 testing, or the administration of COVID-19 vaccines, or any sort of administrative support, such as the disbursement of COVID-19 related funding. That would be considered as COVID-19 support, and it would indicate a yes for this column if that staff member, if that PEPFAR supported worker was also engaged in COVID-19 related services or activities within the past fiscal year. And Jason, you want to take over the expenditure section?
Sure, thanks, Kyle. And for everyone, this is the last section. There's just 3 more columns, and they're related to expenditure reporting. And then we'll transition to doing a run through with the tool and some odds and ends about registering and submitting. But this is the final section. The HRH inventory collects expenditures, which is the same as ER. Expenditures is how much was spent in the last fiscal year on the PEPFAR supported worker. The HRH inventory does not collect annual salary. It does collect expenditures in 3 columns. The first is the sum of annual PEPFAR expenditure excluding fringe and non-monetary expenses. The second is annual PEPFAR fringe expenditure. And the third and last column is annual non-monetary expenditure excluding fringe. And we'll walk through each of those. Next slide. So the first column is the sum of the annual PEPFAR expenditure excluding fringe. This is unchanged from last year. It's where you enter the total amount expended on the individual staff's compensation, excluding fringe and non-monetary expenditures over the past fiscal year. This is free text, so you're entering in a numeric value, a number. All salary, wage, contract fees, and other payments made to the staff should be entered here. All PEPFAR expenditure data must be reported in the US dollars and include these expenditures for the time period of October, for the fiscal year. So October 1st, 2021 to September, I'm sorry, it was October 1st, 2021 to September 30th, 2022. Next slide, please. The next column, similar to last year, is the annual PEPFAR fringe expenditure. Just want to highlight how that's calculated. And that's where you enter the total amount expended on individual staff's fringe benefits, we'll have to change that. So then it's a free text and numeric, and the fringe should include the cost of employers' shares and should exclude any fringe benefits that are not included as part of the approved indirect cost rate. And that includes expenditures October 1st, 2021 to September 30th, 2022. This is a slight error that will change. It does not include non-monetary expenditures. That is something that is in the next column. So we will correct that and we will include it in the updated PowerPoint and in materials that we share. Next slide, please. This last column, I'm sorry, let me quickly do a summary of what's included in the annual PEPFAR fringe expenditure. It does include fringe benefits in the form of regular compensation paid to employees during periods of authorized absences from the job, like vacation, sick leave, and military. It does include fringe benefits in the form of employer contributions and expenses for Social Security, employee insurance, workers' compensation insurance, pensions, etc., and other allowable. There's a few other allowable costs for fringe benefits like housing assistance and rural housing allowance, if that applies. Things that are excluded from this are stipends, cash awards, bonuses, or performance-based pay. Those would be included in the previous column, the sum of annual PEPFAR expenditures, excluding fringe. Also, what is excluded is PEPFAR funding for the construction or renovation of housing for healthcare workers, even if in place of providing a housing allowance to obtain housing on the market. Those are not included in the HRH inventory. And the cost of fringe benefits that were classified as indirect should be excluded. Next slide, please. And the third column, the final column in the inventory before comments, is a new one, and that's an annual PEPFAR non-monetary expenditure excluding fringe. So this is the total amount expended on non-monetary expenditures that excludes fringe. This is aimed to better capture individuals that PEPFAR is relying on for implementing program activities, but are not receiving monetary compensation. So they're not receiving a salary, they're not receiving a stipend. It can include unpaid staff, such as volunteers that don't receive a salary or stipend, but do receive other items like household goods, phone cards, travel reimbursement. The key here is these non-monetary expenditures are for items that are for personal use. So it's not for a phone card if that phone card is needed to fulfill those job responsibilities. It doesn't include supplies, equipment, or other resources that are required for fulfilling job duties. It is a different form of compensation that is for personal use for that staff member. And we're asked, this is also a field where a numeric value is entered, and partners are asked to estimate the value of that non-monetary expenditure for that staff member and enter that estimated value in this column. Next slide, please. So these next tables, we just looking at which of these fields of the 3 expenditure fields you would or wouldn't complete based on the mode of hiring or the different staffing scenario examples. If I was a salaried worker and I receive fringe benefits, we would expect responses for a value entered into the sum of annual PEPFAR expenditures excluding fringe and a value entered into that second column for the annual PEPFAR fringe expenditure. If I was a salaried worker that also received an additional smaller stipend and fringe, That first column, the sum of annual PEPFAR expenditures excluding fringe, would include both the salary plus the additional stipend expenditure. And I would also, we would also anticipate a value entered for annual PEPFAR fringe expenditure if it applies. And if a salaried worker also has fringe benefits and received additional non-monetary compensation, then all three of those columns we would anticipate would have numeric values entered. Next slide, please. Similarly, for contract employees, if they generally don't have fringe expenditures, so we would expect a value in that first column for the sum of annual PEPFAR expenditures, but not necessarily a value entered or not a value entered for fringe expenditures. Stipend workers, similarly, we would expect the stipend amount in that first expenditure column. For contract workers that do receive fringe benefits, we would expect those first two expenditure columns to be completed or have a value entered. You have a value entered for the annual PEPFAR expenditure and also a value entered for the fringe expenditures. And if there was a stipend worker that also received non-monetary compensation, in that instance, we would expect values entered for both the PEPFAR expenditure excluding fringe and the non-monetary expenditure column. So it really depends on whether that individual received, if they were salaried or contracted, and whether or not they did or did not receive any non-monetary expenditures. That information determines whether or not you fill out one of these columns, two of these columns, or all three of these columns. Next slide. Just sort of lastly, to round this out, if there's a staff member that only receives non-monetary compensation, then the only field they would complete for expenditures is that third column, the new column on annual PEPFAR non-monetary expenditures. And I think with that, I know that we have a few things. First, we have now navigated through all of the columns that are in the FY22 HRH Inventory tool. I know that there's been a large number of questions in the chat, and some of them have been answered directly in the chat. But I'm going to ask my colleague Geraldine Hoover, who's been monitoring the chat, to summarize some of the key questions that would benefit addressing now on this call. But I also want to note that we are also receiving a recording and transcript of this training, and we will review all the questions that were submitted in the chat, and we will if it's broadly relevant, that's the type of thing that we will include in our frequently asked question documents and resources, and make that available throughout the submission window. So all questions are being monitored and will be reviewed, but I'm going to turn it over to my colleague Geraldine to see if there are particular questions that we want to highlight during this section of the webinar right now.
Great. Thank you so much, Jason and Kyle and Carolyn, for going through the details of the existing and the updated elements in the HRH inventory for reporting for this next year. So, and thank you all for putting your questions and comments into the Q&A section. I've grouped them by a few different theme areas and thought we could take a couple of them now, and then any remaining ones we can take at the end after we finish going through the demo. Maybe the first question was, we're not allowed to modify the HRH template. What happens if the data that you have is larger than the fields provided? And then there was also a question about whether the template will automatically flag errors and warnings similar to the ER template, or how that will work. So I can provide some initial comments, and then Jason or Kyle, if you guys want to add on anything, that would be great. So basically, you can enter as many rows for individuals into the HRH inventory template as needed for the staff that you have. There's no upper limit on kind of the amount of rows that you could enter into the template. Just making sure that the column structure stays the same across the inventory template, but you can enter as many rows as you need to into it. And then my understanding is that the error messages will not automatically show in the template, but they show upon attempted upload into Datum. So, and I think we'll talk about this more in the Datum entry section, but that's why we would suggest frequently entering into Datum versions of it as you're completing it to check if there's any major errors that you're noticing as it's being completed. But Jason, feel free to add anything else there, or Kyle.
Thanks, Geraldine. You're exactly right. I think that last year, I think those of us know that if you had a very large number of staff members, there was a limit to the number of rows, and that was later fixed with updated templates. So you're right. There's no constraint or restriction to the number of rows of data that you can enter and staff that you can add. The modifications that can't happen are related to adding columns, changing columns. That has to be exactly in the same format it was when you downloaded the template. Your second comment, it's 99.99% spot on. There is only one check within the tool itself, one validation check within the Excel tool, and that's related to geography. If you've entered the correct geography down to the right level, there's a column that says if it's valid or not. But Geraldine's 100% is totally right, where when you upload, and we'll go over this at the end of the presentation of downloading and uploading a template, when you upload your template, then the entire template is scanned for different validation errors, and you will receive a report. You can see a report, a summary of those validation or logic rule errors or anything preventing submission, and those are outlined by row, and then you can troubleshoot them individually. So it's not feedback that you'll be getting within the template. It's feedback that only happens when it's uploaded into Datum. But having said that, there's no limit to the amount of times you can upload and have that check done, upload into Datum and have that review done. So that's the major point of feedback in the process. When you attempt to upload it, seeing that error report, if any errors are applicable to what you're intending to submit. Over.
Great, thanks, Jason. There were a few other questions about employment titles. So, and I can take these two, I think. One question was, should health program coordinators, managers, or supervisors at the community and facility level be considered other professional staff? I think what we would suggest for that is look at the list of employment titles and the definitions that are available for use in the inventory, and that'll be all listed out in the handbook that will be available along with the template. Choose the one that best describes, in the most descriptive way possible, the staff that you're wanting to enter. If there is no option there that well fits them otherwise, then you can use that other, like an other title, like the other professional staff title. But as much as possible, it would be helpful for us to know as specific of information as is accurate. So we tried to create a range of titles to capture the different roles and responsibilities that people might be supporting. So just try and use the title that's as descriptive as possible and closely fits their role. Then there's also a question about, we have peer navigators who work in facilities. Should those people be listed as community or facility staff? If they're peer navigators, but the majority or all of their work is being done within a facility site or within facility sites, then those people should actually be reported as facility staff. So you would use the title peer navigator and then report them as facility staff. But if the location of their work is in the community and they're not really working directly in facilities, or they're not tied to specific facilities, then you would report them as community staff. There were also a few questions about program areas and how to report time for staff that are working evenly on multiple program areas. So I think in the example Kyle gave, it was, 75% of their time is on one program area, maybe 25% is on the other. But what about if it's 50-50? I think for that, what we would recommend is that if there's not any clear majority program area that they're spending the most of their time on, you just need to choose one of the program areas. One option would be, though, you would choose one of the program areas, and then the full amount of level of effort that they're supporting across all of the work that they do for PEPFAR. We also, though, have there's a column at the very end of the entry, and for individuals where they're truly evenly split across multiple areas, if you would like, as optional, you could just make a short note of that at the end of the entry when you're putting it in. But otherwise, you would just need to choose one of the program areas if they're supporting several different ones equally. Let's see. I think There were a few different questions on type of compensation. Maybe I'll take these ones, the last ones right now, and then we can answer anything else at the end of the demo. So there was a question about how do we report communication cost or airtime for contracted staff? So I think Jason covered this in the discussion about non-monetary compensation just now, but basically, if someone is only receiving non-monetary compensation, but it's for their personal use, so like airtime for personal use, and that's the only type of compensation they receive, then it would be reported as non-monetary only. But I think otherwise we would, if they're contracted staff, we would report costs associated with their salary under the salary costs as contracted staff. Jason, do you have anything else you would suggest there?
No, I agree. I think that's exactly right, Geraldine.
Okay. And then otherwise, there were a few other questions about kind of how to report contracted personnel or people that receive stipends or people that are so maybe supported by different funding streams. So generally, kind of I think the high level answer that gets at these questions is basically what should be reported into the HRH inventory is staff that are receiving any portion of their support from PEPFAR. That amount of their LOE is what should be reported into the HRH inventory. So for example, if I'm a nurse and 50% of my time is supported by PEPFAR through one mechanism, but maybe 50% of my time is on something totally otherwise, we would report only the 50% of my LOE that is paid for by PEPFAR. So that's what the goal of this exercise is to get at, is the level of effort and staffing support that is being supported directly by PEPFAR. So if someone is receiving funding that pays for part of their position that's outside of PEPFAR, you would only report the level of effort and the work that they're doing for the PEPFAR funding that they are receiving as part of their role. And then the last there were two questions, both on kind of how do you converting local currency to USD at the IP level when you're going to enter the information. Generally, this might be a mission specific question, so you could check with the HRH point of contact at your USAID mission, because they might have a specific rate that they suggest. Otherwise, what we would recommend is to use the same rate that you use for entering the expenditure reporting template that you're going to be submitting as well, so that it's consistent across the two. So I think I will pause there, but if you have any other burning questions that come as we go through the next section, please feel free to enter them into the Q&A, and we'll try and get to as many as we can at the end. And if we can't get to your question, we will respond in writing afterward.
Thank you very much, Geraldine, and thanks everyone for your questions. And again, if there's questions in the chat that we didn't raise, we will be reviewing those and keeping communication open throughout the submission process. I turn it over back to you, Kyle, who's now going to navigate through a couple different scenarios and show the HRH inventory tool itself and how to complete it. Kyle?
Sure, thanks, Jason. And just looking at time here, is we probably have like a few minutes, like 10 to 15 minutes, to just do sort of a live demonstration of how you would fill out the data collection tool, given a number of staffing scenarios. We did this last year, but we wanted to also do this again this year with the amount of time that we have, so that you can see how you would fill this out within the data collection template. So I'll be resharing my screen again shortly, so you can see how I would be filling this out in the data collection template on Excel. But just to give you an overview, for this section, we wanted to provide an overview of how different staffing situations would be filled out within the Excel-based data collection tool. So here within scenario A, all the way through E, we have around 5 scenarios here. We go through the more straightforward scenario for scenario A, where we provide direct service delivery at one single facility, service delivery at multiple facilities, usually for roving staff. And thirdly, direct service delivery within a community level. So usually staff doing community level interventions and not necessarily tied to a particular facility. And then for scenario D, usually a technical advisor providing human resources for health advice or support seconded to the Ministry of Health. And then lastly, an example where we have a part-time volunteer worker that received mainly a non-monetary compensation. So let me reshare my screen here, and live demonstrations are always tricky to do, so hopefully this goes well. Let me exit out of the PowerPoint here and go back into the data collection tool. So this is the data collection tool example, and this is a Kenya template example, by the way. There's 3 tabs here, but we'll mainly be going through the staff list area, which is the main tab that you'll be working in. And in terms of the first scenario, let's take a look at it here. And I believe if Geraldine or someone could put this scenario in the chat, just for everyone's reference. So for the first scenario, we're going through service delivery at a single facility. So for this example, we have a female nurse working full-time throughout the entire year at a health facility supported by an implementation partner or IP. She was hired at the start of the year to provide general HIV care or HIV care and treatment services or CNT, and is paid her salary directly by the prime implementation partner. Within the past year, she was asked to divert some of her time on COVID-19 services, specifically on COVID-19 testing. Her total salary expenditure over the past 12 months was $11,000, with her fringe expenditure being $1,820. So that's the scenario. And now we'll go through the Excel-based data collection template to see how we would fill that out. So here within the staff list tab, these are the different data elements that we already went through in the previous slides. But here for this specific scenario, we will go through each of these fields one by one. And here for column A for record number, again, we recommend to leave this blank. We don't want to run adding the risk of adding personally identifiable information there. So leave that as blank. For this scenario, whether that person was employed through the prime or sub IP, in this case, that nurse was employed by a prime implementation partner, so you would put down as prime. For column C here, this was not hired by a subrecipient, so this is grayed out, so you cannot enter a field there. For gender, there was a female nurse, so you would select female. For employment titles, within the expanded list of drop-down menus here, there's different types of selections. There's ancillary staff, clinical staff, but since this is a nurse, this would be under a clinical staff and would fall under the nurse employment title. In terms of mode of hire, that person was a salaried staff member, so you would put down a salary. She was not contractual and not a non-monetary. She was a salaried nurse hired by the IP. And whether that person was MOH staff or seconded to the MOH, that would be a no, because that person was supporting a single facility as an IP supported facility as a nurse. And in terms of months of work within the past year, she worked for 12 months within the past year, so you would put down 12. And in terms of average FTE per month, since that nurse was working full-time, you would be putting a value of 1, an equivalent of 1 FTE for that nurse, since she was working full-time for that health facility. And here for this column J, primarily supporting work in the community. In this case, we would put down as a no, because that nurse was providing health services, facility-based services within a single facility. She was not doing community level work. And in here, whether that staff member was working in or supporting multiple health facilities, that would be a no, because that nurse was not considered roving staff. She was only working at one singular facility. So it would be no, she was not working, she was not considered roving staff doing multiple facility work. For column L, whether she was providing technical assistance or TA, that would be a no, she was doing facility-based delivery work. And then whether the position was based outside of the OU, that would be a no, because she was working a country-based worker, mainly focused on service delivery within one health facility. And here, you can see here highlighted in blue, these are the geographic columns, which allows you to designate the geographic location in which that worker was working under. This was in the previous slides where we worked through the Datum hierarchy geographic column slides. And in this example, this particular worker was doing her work location was at the facility level. So in this case, in terms of the geographic location that you would be reporting under, you would go all the way from PSNU, SNU2, community, all the way down to facility, because that health worker was doing work all the way down to the facility level. So you would be filling out column N all the way to column Q. So this is a Kenya example. I'm just gonna randomly select drop-down menus here. For example, in terms of geographic locations, you would set down a county that health worker was working in, sub-county. And then for the community level, you would be selecting a particular ward that female nurse was working under. And then within that specific ward, you will then select the specific facility that nurse was working in. So that's a more straightforward example of how you would fill out the geographic location of that worker. Since she was doing facility level work, you would report down all the way down to the facility level in column Q. Okay, great. So the last few columns here, we will again go through additional fields in terms of the primary program area for that worker. I believe for that scenario, she was doing site level work and was providing general care and treatment services. So you would select a site level designation for general care and treatment. In terms of the primary beneficiary, I believe in that scenario, there was no sort of specific target population that nurse was providing general HIV care and treatment services for that health facility's general catchment population. So they would fall under a non-targeted population here as your primary beneficiary. Whether that nurse providing services directly to beneficiaries, yes, that it was a nurse providing direct service delivery work, so it would be SD category. And then within the last year, was she providing COVID-19 support? And that would be yes, she was involved with COVID-19 testing as part of her role. And in here, these are the expenditure related columns. Again, for that nurse, she had a salary, which you would include here in column Y, and she had related fringe expenditure, which you would include here in column Z. And she did not have any sort of additional non-monetary compensation, so this would probably be 0. So I'm going to go back to that slide again. Her compensation was 11,000. So you would put 11,000 here for a salary. Her fringe expenditure was 1,820. So you would put that as 1,820 here for the fringe expenditure column. And within that scenario, she did not receive any additional non-monetary related expenditure. So this would be a 0. So that's the full walkthrough of one straightforward example of a facility-based worker. Hopefully that makes sense. If you have any additional questions on that, definitely add it in the comment section as we'll be going through it later on. We do have additional staffing scenarios here, and we'll get through it as much as we can. But we do have one last section of this training where we go through how you would upload your template to the Datum website or the Datum portal. So we'll have probably spend an additional 5 to 10 minutes on this before we move on. But let's go to the second staffing scenario here. I mean, this table on the right basically shows you what I already filled out in the data collection tool. For scenario B, the second scenario, let's go through this again with the time that we have. So in scenario B, we have direct service delivery at multiple facilities. Essentially, it's the same scenario as the previous one, but this person was focused on multiple facilities during her work. So in this example, we have a female nurse providing HIV clinical services primarily for pregnant and breastfeeding women, working full-time, supporting multiple facilities, and she was hired halfway throughout the year. Her salary is paid directly by the IP, and within the past year, she also provided COVID-19 support. Her salary total expenditure was $5,500, with her fringe expenditure totaling $900 935. So in this case, if we go to the data collection tool in terms of how you would fill that out, you would go through, it's in here, and in this third row here, you would put down for this particular scenario, it was a nurse that was hired by the prime. You would skip column C because it was not hired by a subrecipient. She was a female nurse. Again, it would be clinical staff under nurse. This is the same here for modifier. She was a salaried worker. She was not seconded to the MOH. She only worked for half a year, so it would only be 6 months. And her average FTE per month would be 1 because she was a full-time worker. Primarily supporting in the community. No, she was not doing community level work. She was supporting multiple facilities. So she would be considered as roving staff since she was doing multiple facilities at once. She was not providing TA, and she was she was based within the OU. So we put a no for there. And in here, it was again for the Datum hierarchy. Since she was considered roving staff, you would actually be filling in all the way to the community level column here because she was supporting multiple facilities. So in this case, she was not tied to any one particular facility. So in this case, you would report all the way down to community level for which those several facilities was, you would report down the community that those multiple facilities was located under. So in this case, I'm just going to randomly select a county here, a sub-county, and then the community in which those multiple facilities was located under. That would be a specific ward in terms of the multiple facilities that staff was supporting. For primary program area, I believe in terms of the site level work that that person was supporting, let me go back to the scenario again. She was providing HIV clinical services. So you would put down to a site level work for HDS, for HIV testing. It's for care and treatment services. She was doing HIV clinical services. So you would select that. And then in terms of the targeted population, she was mainly targeting primarily pregnant and breastfeeding women. So you would put down for the primary beneficiary, pregnant and breastfeeding women as the option. And of course, she was doing direct service delivery. She was providing COVID-19 support. And then here, her salary was $5,500. And then her fringe expenditure was totaling $935 here. And then non-monetary expenditure would be 0 since she did not receive any additional support for non-monetary compensation. So hopefully that makes sense. We only have 5 minutes left, so I'll probably just, I won't be going through the data collection templates live demo anymore, since hopefully those first 2 examples should give you an initial overview and sense of how to fill out the data collection tool within the staff list tab. This is the main tab that you will be filling out for the HRH inventory tool. But hopefully that should give you a good overview of how this process is done. But I guess, like, for the sake of time, I'm just going to go through the additional scenarios here from scenario C all the way to scenario E. I'm just going to go through this in slide format now that you have a sense of how to do that in the Excel-based tool. So here in the third scenario, we have direct service delivery within a community, but is not necessarily facility-based. So in this example, we have a staff member hired by a subrecipient. In this case, it's Japago, providing pre-test counseling, testing, and post-test counseling services, targeting young women through mobile community-based testing interventions. The sub-IP hired 10 lay counselors, 5 of them were men and 5 were women, and each of the 10 staff were hired through contracts that paid them $2,850 each as a lump sum for 6 months of full-time work, and they did not receive fringe benefits as contractual workers. So in this case, in this table to the right, similar to the data collection tool, this is how you would fill it out. In terms of the whether that person was prime or sub IP, you would say that that person was a sub. In the next row, you would say that you would then select the subrecipient name, which in this case was Japaigo. And then in terms of the gender for that staff member, you would have, of course, 10 rows for each of those staff. But then if they're male, then you put male for each of them, and if female, you would put female. In terms of employment title, they hired mainly lay counselors that also provided testing services. So you would be putting down ancillary worker under the lay counselor employment title. Their mode of hire would be contractual, so it would be contract. They were not seconded to the MOH. In terms of months of work within the past year, they only did 6 months of work, but they did work a full time within those 6 months. So you would put a 1 here. In terms of support in the community, you would say yes, because they were mainly doing community-based testing work. So it would be yes, they were providing community level support. For roving staff, that would be a no, because they were mainly at the community level. They were not doing facility-based work, so it would be a no for roving staff. And then for technical assistant staff, it would also be a no, because they were not doing TA support. Whether that person was based outside of the OU, that would be a no, because it was country-based staff doing work at the community level. So again, as I showed in the geographic entry columns, you would report down all the way down to the community level column, because this worker was doing community level work. So in terms of the lowest geographic location you would report under for the work location, it would be under the all the way down to the community column. And here you would see that for these workers, their primary program area is community-based testing. And then in terms of the target populations, is mainly young women and adolescent females in this scenario. They were doing direct service delivery work, mainly through community-based testing. So you would put that as service delivery. No COVID-19 support. And then here you would put down their total contractual lump sum amount of $2,850. Let me see, we only have a few minutes left, so I'm going to breeze through these next few scenarios now that you are all hopefully have a good idea of this. So in this last few scenarios, we have an HRH advisor, a female technical advisor employed by the IP and seconded to the Ministry of Health. And they were tasked with development of a new national human resource for health strategy. And she worked at the Ministry of Health in the capital city, and she received a salary with fringe expenditures. So basically, what's the thing to note here is that in the employment title, you would say that she was under other staff, under technical advisor. She did receive a salary and was a full-time worker with FTE of 1. And in terms of the level of reporting, it would be SNU 1, since she was a TA advisor. This would probably just be the country that she was mainly supporting for. In terms of primary program area, it would be an above site activity, mainly focused on human resource for health, since she was mainly providing a new HRH strategy advisory support. There was no specific target population. She was mainly doing non-service delivery work. And then in here, you would include her total salary and total fringe. And then for the last but not least scenario here, this last scenario is involved with having a female community health worker, mainly recruited through a prime partner to educate and mobilize local community members, in this case, mainly young women and adolescents, to encourage uptake of HIV testing and counseling services. She is a volunteer worker that did not receive any monetary compensation, but she did receive phone cards and other household goods valued at about $500 for participation in the program for her personal use. And then lastly, she only worked for 4 months during the year and working part-time at about 2 weeks per month. So in this case, the key things to note here is that their employment title is mainly they're ancillary workers, community health worker by designation. And in terms of their compensation, they were only non-monetary only, since they were not salaried, they were not contractual, they only received work incentives in the form of non-monetary compensation. In terms of months worked in the past year, it's only 4 months, and they only worked part-time for half a month, so it would be 0.5. And again, in terms of SNU level to report, they would be reporting down all the way to the community level, since they were a community health worker. Their lowest level of geographic reporting would be down to that community level column. And then lastly, in terms of primary program area, they're mainly doing site level work focused on prevention, doing community mobilization work. So that would be the primary program area that best fits that. The primary beneficiaries is young women and adolescent females. And again, they were doing service delivery work focused on community mobilization. And then lastly, in terms of the expenditures for this volunteer worker, it would be 0 for salary/wage. It would be 0 for fringe expenditure, since they did not receive any fringe. But their total work incentives or non-monetary expenditures is 500, because the phone cards or household goods or related work incentives for her participation in the program totaled about $500. So you would put 500 for the non-monetary compensation column. So that was a lot. Those are the defense examples. I'm sure there's questions around that, but please do so in the chat. But for the sake of time, I'm going to hand it over to Jason to walk through the Datum hierarchy, the Datum reporting in terms of how you would actually submit the data collection tool on the website. This slide I will not go through, since again, we already went through the different levels of geographic reporting already.
Right, and we'll skip through this Q&A as well, Kyle. We'll have a Q&A session if there's time remaining on the end. And again, we're monitoring all the questions that have been submitted, including the last several minutes, and we'll include that in our FAQs and other communications following this presentation. Next slide, please. I do want to provide an overview of how to report in Datum, and this is exactly the same. The dates are different, but this is the exact same process as last year. So this will be a reminder for folks who did this in FY21, and it'll be new for partners and colleagues doing this for the first time. But as I said, please request a Datum account, because October 3rd to November 10th is when it is open for submissions for the Q4 submission period. And then it is also open for a second 2-week window, December 1st to December 16th, if there are corrections that need to be made. But outside of those 2 windows, the system is closed for submitting HRH inventories for FY22. Next slide, please. So what do we need to do to submit this in Datum? Is first request an HRH Datum account, going to register.datum.org. You can log into datum.org, and once you have that account, you can log into datum.org and download your OU specific template, which will be available at the latest October 3rd. Complete the template, and once it's completed, it's logging back into Datum, into an HRH app, which will show you some screenshots of what that looks like, where you can upload the template. That's when we will there will be a report for any errors, and once that's submitted without errors, we can navigate to a separate app, the data approval app within Datum. And again, we'll walk through this briefly, where it can be formally submitted and approved for completing this activity. Next slide. So there are a couple accounts. If you have a Datum account, but you don't currently have not submitted HRH inventory, you need to request you need to request that your current Datum account be updated to give you permission to submit the HRH inventory data. And that's something that you can, so you're either going to register for a new account, or you can contact the help desk and have your account changed, designating you as the person submitting the HRH inventory for your implementing partner. Next slide. Again, that process is if you're at register.datum.org, there's a link to request a new user account, where you're entering information about yourself, your email, the OU support, the implementing partner name. You would select that you need to access HRH, and that you're accessing data entry, HRH inventory, and submit data. And then the apps that we're going to show you the screenshots for, you will have access to when your account's been created. Next slide. Yeah. Okay, great. And this is just more information to complete to have that account created. You can have your account. I see one comment from Peter. You can have your account settings changed, or you can create an additional account. So whichever you prefer. Next slide, please. Yeah, okay. So again, if we're logging into Datum, so now we have our user account created and we are going to datum.org and we see our username and password, or we enter that. Next slide. We are in Datum and we will see on the top right, next slide please. Yeah, we see on the top right, those 9 squares, sort of like an apps. And the first app we would go to is called the HRH Processor app. And so we'll see that HRH Processor app and we'll select that. Next slide, please. Within the HRH Processor app, we'll select the operating unit where your partner is supporting. You'll select the copier, so COP21, FY22. You'll select the, you can select the individual funding mechanism, and there will be a link where you can then download the HRH template. Next slide, please. And so there it is. There's an option to request the template, or you can download it. You download the Excel file, you save it to your computer, and now you have the blank template for that OU that will need to be completed. Once it's completed, next slide. There it is. Talking about everything that we talked through earlier, completing the cover sheet and completing all of the columns in the staff list, 1 entry per row for each staff member. If we go to the next slide, we go back to right where we were before. We go back to, we log into Datum, we click on the apps, we click on the HRH Processor app, we select the OU and the copier, we go everywhere to exactly where we went to download it, but now we have an option to upload the completed template. So you'll click Upload Template, you'll find the template that is completed and saved on your computer, and you will upload it into Datum. Next slide, please. Once it's uploaded, you'll now see one of 2 reports. You'll see the top one, which says it's a success, and means there's no errors, and it was successfully uploaded. But if you do have errors, that will come in. You'll see a status report, and it will list the errors that were detected in your submission. And next slide. And those data validation errors are processed once you upload it into Datum. They check for logical or value checks. An example would be you said yes to deliver services directly to beneficiaries, but then you also said yes as technical assistance. And so say, these 2 things, are these consistent? It does different checks based on the data that was entered, or if there were changes made to the template, it will detect an issue any issues that have prevented successful submission of the template. Again, there's no limit to the amount of times that you can upload the template and run these data validation checks to review if there are any issues. And this is just something this is another reason why we recommend frequently uploading it and not waiting to the submission deadline in case there are a number of errors that need to be addressed. Next slide, please. Some tips. And again, this is in the supporting materials, but prior to submission, we definitely would want to check for completeness and see if there are blanks in the column, check for logic, reviewing the error messages, but also making sure that the selections for a particular staff member are compatible with other selections in other columns, checking for duplicates, checking for extreme values. If you're seeing an expenditure that is 100 or 200 times multiples of what the other expenditures are, is that potentially a data entry issue? Oftentimes last year, it could be related to one sub IP, perhaps not converting to US dollars. And so all the values in the expenditure column were very different for that sub implementing partner in the aggregated file. Just looking for extreme values and checking within the geography to see that if the geographic levels, it was the right level of localization for the type of staff that based on the other selections. Next slide, please. So we have talked about how to download, how to complete, and how to upload, but there's one final step to officially submit. And that requires going into Datum in the apps and clicking on the Data Approval app. And when you're on the Data Approval app, you can view, next slide, you can view the, maybe go back one, I got a little ahead of myself. You can view the submission status of your mechanism, of your HRH inventory. And by this point, if you're in that Data Approval app, you'll have already uploaded it. You'll have already seen that there were no errors. And now when you click on the Data Approval app, you'll just need to click on it and hit Submit, press Submit. I know this seems like an extra step, and we tried to consolidate that this year, but it is a 2-step process in Datum, again, this year, just as it was last year, where there's uploading it, and then there's a separate step to officially submit the template. Next slide, please. So I'll just work through this. As when will you see error messages? Is something in the HRH inventory templates incorrect? Will it be immediately when you enter the data? Will it be when you attempt to upload in the data map? Or will you only be notified by errors when someone on the agency staff reviews it? And if we could just move to the answer, Kyle. It is B. When you attempt to upload Datum in the app is when you will have that error report generated. Yep. Next slide, please. And will Datum accept a template if there are outstanding error messages? Yes or no? And we can move to the response. No. All error messages must be addressed by making changes to the data and then re-uploading it before Data will accept that submission. Next slide, please. We're going to push this to the very end, time permitting. And feedback surveys popped up. Okay, Kyle, can we go to the next slide, please? Lastly, we want to point everyone in the direction of resources. They are in the same locations as last year. We're at the datum.zendesk.com. There are 2 key places to find guidance and instructions. And this is also, if you look on the lower right corner, that's a way if there's technical support with Datum. They have their own help desk, and that is how you can submit tickets or ask specific technical Datum questions. Next slide. Those 2 boxes where all these materials have been hosted for the FY21 HRH inventory and will be updated for FY22 HRH inventory. And that includes an introduction to PEPFAR HRH inventory, definitions, the HRH inventory handbook, which includes definitions for all the data elements we discussed today. The HRH inventory templates are available for download within Datum, but we'll also post a checklist before submitting and approving HRH inventory templates. That's where the SGAC hosted interagency frequently asked questions will be published. We do have an FTE calculator there, but it's also included in templates and other information on Datum training and tutorials. We will separately be generating an FAQ within USAID, just as we did last year. We will be sharing that with our missions and our HRH POCs and other contexts, starting from that will include questions that we're receiving today and throughout the entire submission process in Q4. We will be sharing that with increasing frequently. I think last year we started it on a bi-weekly basis, and then we did it more frequently than that as we were getting more questions and as we were getting closer to the deadline. We will similarly be working on and updating USAID FAQ for HRH inventory to support everyone with the questions that anyone has related to this process. Next slide, please. Next steps for everyone. Again, if you do not have a Datum account, please request a Datum account at register.datum.org to obtain the HRH permissions. If you are the person that's going to be downloading, uploading, and submitting your HRH inventory on behalf of your IP. Please review the template and guidance materials. You said several times this presentation is going to be available by tomorrow. A recording is going to be available by tomorrow. SGAC is doing a presentation next week. That will be available. We can share those materials. We're anticipating the updated guidance for FY22 to be finalized and updated next week, and we will share that. If you have direct questions about this training, the colleagues who presented, Kyle, Caroline, Geraldine, myself, we all have access to this HRH-reporting-help desk at usaid.gov. If those questions are directed there, one of us will respond. If it's a question that would benefit a broader group, it will be included in our frequently asked questions. If you have direct mechanism-specific questions, we ask that you direct those to the ACORs, the activity managers, and your mission HRH POCs. As I said, USAID recirculating our own FAQ that we update throughout the reporting period and distribute to mission POCs. That became a LinkedIn document last year and received lots of positive feedback, and we will be generating it again this year. We would also say as the next step, even though it's prior to October 3rd, start beginning to collect the data needed to complete the inventory. And we recommend uploading prior to the November 10th deadline so we can see those error messages. And if there's things that we need to troubleshoot together, we have a little bit more time to do that. Next slide, please. Thank you all very much. We are right at time. I will see if there is the most pressing of questions. Geraldine, if you saw one in the most recent batch, maybe we can respond to one, but we will read them all, and we will include them in our supporting materials to make sure that these questions are answered and everyone has what they need. Geraldine, was there maybe one question, or do you think we're okay to wrap up for this first session?
Thanks, Jason. I think we were able to get to most of the questions either live or in writing, but if we were not able to get to your question, we will make sure to note it down and provide written responses in the FAQ document about the inventory reporting that Jason mentioned. And then we'll also be regularly checking that HRH reporting help desk email. So if you have other questions that come up as you are starting to prepare for the reporting, please don't hesitate to email us directly at that email, and we will review your question and follow up as soon as possible.
Great. Thank you very much, Geraldine. Thank you, Susan, our colleagues from ASAP. Thank you, Kyle and Caroline. And thanks most of all to everyone else who joined the call and is going to be filling this out and submitting this data. We really appreciate it. Please utilize the resources that we're making publicly available, that we're communicating via email, let's do everything we can for another successful year of HRH inventory submission. So thanks very much, everyone, and look forward to hearing from you soon. Take care.